Hi, Dr. Windisch here from Sparks Pediatric and Adolescent Medicine again. Remember our phone number is area code 775-359-7111. Welcome to our video series for professionals and for students. If you're interested in scheduling a rotation with us, give us a call. We'd be happy to have you here. Today's video is actually a follow-up to a video we posted a couple of weeks ago. If you're looking on our website, it's hard to tell the order things were posted, but if you're looking on YouTube, you can see the dates of the postings. The video from a couple of weeks ago looked at breast milk and the advantages of breastfeeding, as well as how many calories a baby needed per day. Today we want to turn our attention to the differences between the commercially available formulas. Let me remind you that a term healthy newborn who's not in heart failure, who does not have catch-up growth to do because of history of malnutrition, who is not an ex-preemie, who doesn't have cancer, is roughly 110 calories per kilogram per day. That translates, if you're using 20 calorie per ounce formula, which is what you should be using for this group of patients, into about 180 milliliters per kilogram per day. For those of you who don't know, 30 milliliters is roughly 1 fluid ounce. So you can do the math there and figure out how many ounces patients have to take. What I want to talk about here is what are the big differences between the commercially available formulas and what are the big uses for each of the commercially available formulas. And we're not going to really split hairs here and get into some of the real technical details. I just want some big lump groupings. This is what I want my students, both med students and PA students and NP students to know. What you need to know if you're planning to become a pediatrician, if you're a pediatric resident, is a lot more detailed than this. And certainly if you're a pediatric resident and you want to discuss this further, we can discuss it on a rotation here in quite a bit more detail, but we're going to simplify it a little bit because this is generally what you need to know on a day-to-day basis. So formulas come realistically in three big groups. They come as cow's milk-based formula, soy milk or soy formula, and partial protein hydrolysate formula. And what I really want students to understand is how the proteins are derived and vaguely what fats are in there and what carbohydrates are present. So we'll start with the cow's milk-based formula. That's your Enfamil, that's your Similac, that is Carnation Good Start, Kirkland brand makes regular formula as well. And there's a couple of other off-brands on the market, all of which are acceptable. The carbohydrate in there is lactose, milk sugar. Same stuff that's in cow's milk. Okay, this is not cow's milk, but it's the same stuff that's in there. Consequently, if you're lactose intolerant, this is not going to work. Now, babies are not typically lactose intolerant, at least at birth. It's pretty rare. It can happen, but it's rare. You can become lactose intolerant after a bad case of diarrhea and temporarily be lactose intolerant, and that would be a reason to avoid the lactose with a formula that's lacto-free. But most people can tolerate it. If a baby has galactosemia, they can't digest the galactose, which is one of the component sugars in the lactose. Consequently, they can't have cow's milk-based formula, nor when they get older can they drink cow's milk. They'll get sick. The protein in there is cow's milk protein, whey and casein. Makes sense, it came from a cow. If you are sensitive to cow's milk protein, such as a baby who's had cow's milk colitis, then you can't have this formula, at least not for some length of time, and not until there's been substantial healing of your GI tract. Finally, the fat that's in there is a combination of long-chain fatty acid and some medium-chain fatty acid, but mostly long-chain fatty acid. Remember that this has to be actively transported across the gut wall. So patients who are short gut don't do well with this fat combination. And patients who have real high GI motility because they're on pro-motility agents, for example, might not do real well with this combination. The next one we want to look at is going to be your soy-based formula. This comes from soy. The sugar that's added to this to give you a carbohydrate is dextrose, glucose, essentially. Okay, so there's no lactose, it's lacto-free. There is no galactose. It's galactose free, so galactosemic patients can take this. The protein is soy-based protein, so you're not going to have problems with it if you're cow's milk protein intolerant. Having said that, patients who have cow's milk colitis, 25% of them are cross-sensitized to soy formula, at least temporarily. So if you have a patient where you think they have cow's milk colitis, you cannot put them immediately on a soy formula. You must use a partial protein hydrolysate for a few months until the GI tract heals. Then you can transition them over to soy. The proteins in there again the fats in there again are a combination of long-chain fatty acids and medium-chain triglycerides. Finally, your partial protein hydrolysates. Well, I should say with your soy formulas, be aware that these are things like Isomil, like Prosobi, like Carnation All Soy, Kirkland Soy Brand, etc. And again, there's generics for this. Your partial protein hydrolysates, this is Alimentum, this is Nutramigen, and slightly different formula called Progestamil. And these actually take cow's milk protein again. We'll start with the sugar. The sugar is glucose or dextrose. Okay, so again, lacto-free. The protein, this time they take cow's milk protein, but they cook it usually with the addition of a little bit of sodium hydroxide. The protein is then digested into short-chain polypeptides. These polypeptides are small enough that they don't stimulate the immune system well, and generally won't stimulate the immune system, though there are some exceptions to this. Consequently, kids who are cow's milk protein intolerant do very well with this. If you have cow's milk colitis, this will usually allow the gut to heal. The the fats for Alimentum and for Nutramigen are again long-chain fatty acids and a little bit of medium-chain triglycerides. In the case of Progestamil, it's all medium-chain triglycerides. The medium-chain triglycerides do not require active uptake from the gut. They are passively transported across the gut wall, so uptake is very rapid and does not involve an active process. So patients with real high GI motility disorders, patients with short gut do much better with the all MCT oil, medium-chain triglyceride oil. These formulas are very expensive. Because they're partially hydrolyzed proteins, they smell like partially hydrolyzed proteins. And that's what gives vomit its characteristic smell and taste. So they're not the yummiest of formulas. Fortunately, the babies usually take them without any problem. There are some very special formulas on the market which involve free amino acids that is outside the scope of this conversation. We will discuss that at another time, perhaps. I hope this has been of some help answering some questions you might have about formula. Again, this is Dr. Windisch from Sparks Pediatric and Adolescent Medicine. We'd love to have you here for a rotation. Our phone number is area code 775-359-7111. We'll talk to you later.